Knee replacement. Even if the doctor has told you that you are bone on bone, if you're considering having one, stick around. I'm going to show you 3 quick things that you should do before having your knee replaced. Hi, my name's Justin Stiver, Doctor of Physical Therapy and founder of The Active Adult. I'm here with you today in one of our 7 Total Therapy Florida physical therapy clinics in sunny Sarasota, Florida. Or as I like to call it, the knee replacement capital of the world. At Total Therapy Florida, we saw about 1,300 knee replacements in 2023. And since we started in 2018, we've seen over 5,000 total knee replacements go through their rehab process. And we've learned a few things along the way. And one of the things that we learned was sometimes it's equally as important what you do before surgery as it is after surgery. Once you have surgery, just due to the trauma of the surgery that you're having, you're going to have swelling around and inside of that joint, or edema and effusion of your knee joint. That kind of limits you on how far you can bend your knee, because of that fluid, when you start to bend and compress, has nowhere to go. So if you take some time before surgery and do some stretches that you are not going to be able to do right after surgery, you can get way ahead of the curve. The first exercise I'm going to show you is called the calf stretch. So you can use whatever you have at home. So normally the step going into your garage or maybe your lanai is about 4 inches tall. That's perfect. Just make sure you have something to hold on to. So I'm going to come up on the step, and you're going to start off by going up on your toes and then slowly controlling down until you feel a nice stretch behind the back of your calf. When you feel that stretch, it should be strong but comfortable, not bringing tears to your eyes. You're going to hold that for 15 seconds. When you're done with 15 seconds, you're going to go back up to your toes and slowly descend back again into that stretch. 15 seconds again. Repeat that sequence 5 times. The second exercise I'm going to show you, one of my personal favorites, the quad stretch. I'm using a chair today, and I'm going to put my foot on the arm of the chair. If you're a little bit less flexible, you can also use the seat of the chair. It's also important to have something to hold on to. The quad muscle, which is on the front of your thigh, is a resistor of knee flexion. And it's also something that you're not going to be able to get to stretch after surgery because of the amount of swelling that you're going to have in your knee joint. We typically can't even perform an effective quad stretch till maybe week 5 or 6 post-op. So if you can get at it now, before you've had the surgery, it's better. So you're going to hold on to something, lean forward, and kind of swing that foot up and around. If you simply try to pick up your foot over the top of the armrest on the chair, it's a good chance you're going to get a cramp in your hamstring. If that happens, don't worry about it. Just bring it down, shake it out a little bit, and try it again. But the trick to getting this without the cramp is by leaning forward and swinging the foot up and around. Once you get up, you're going to tighten your stomach. You're going to squeeze your glute. And by doing that, you should feel a good stretch in the front of your thigh. When you feel that stretch, hold it 30 seconds and repeat this 3 times. We've already talked about how to stretch your calf, how to stretch your quad. Now we're going to talk about your hamstring. All 3 of these muscles cross the knee. When they get tight, they kind of pull those bones together. And again, it's something that we're not going to be able to stretch immediately after surgery. That's why it's so important now. So I'm going to start off laying down. It's okay if it's a little softer than this table here, so do it at home in your bed. If you feel comfortable getting on and off the floor, that's fine too. You're going to lay down, reach behind your leg, pull it back to 90-degree angle at your hip so that knee is facing straight up towards the ceiling. You're going to use the muscle in the front of your leg to kick out and stretch the muscle in the back. Right now I'm feeling a good stretch in the back of my hamstring. I'm going to hold that for about 15 seconds, and then I'm going to lower it down. Again, kick out by using the muscle in the front to stretch the muscle in the back. I also have my toe pulled back because I feel a little bit better stretch, but you can play around with the foot angle and figure out what works best for you. Repeat that 5 times, holding 15 seconds. One important thing to keep in mind is that these 3 exercises are all stretches. So you should feel a stretch of the tissues when you're doing this. You should not feel that pain, especially that bad pain that caused you to want to have a knee replacement in the first place. So if you feel soreness for maybe 24 hours after doing these, that's totally normal. But if that soreness persists beyond 24 hours, that may be your cue to dial things back a little bit. If you like this content, please like the video and subscribe to our channel by clicking the button below. We put out this content for you for the sole purpose of getting you moving, keeping you moving, so that you can live the life you love. Until next time.